Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Dr. Maryam from Department of Pharmacology, Faculty of Pharmaceutical Sciences, East University, Faisalabad. Today I am presenting my study on anti-inflammatory potential of Dermatopsis musculata methanolic extract in an experimental polyarthritis model. First of all, there is introduction. Polyarthritis is a chronic inflammatory disease associated with pain, swelling, and bone degradation. Current therapies are effective but mostly associated with severe side effects. So there is an urgent need to develop new therapies to manage the problem safely. Compared to the synthetic drugs, plant-based medicine or therapies cause fewer or less side effects. Research gap. The plant of the study is Dermatopsis musculata, which is also called African hosta, belongs to the family Asparaceae. Despite its traditional use, scientific evidence on its anti-inflammatory, anti-polyarthritic effects are limited. The phytochemical profile of the plant has not fully characterized. No systematic in vitro and in vivo studies have validated its folkloric use. The molecular mechanism underlying its activity is still unclear. The study aimed to bridge these gaps through detailed scientific and molecular evidence. Aim of the study. The aim of the study was to evaluate the anti-inflammatory and anti-polyarthritic potential of Dermatopsis musculata methanol extract in formaldehyde-induced polyarthritic rat model. Then there is experimental design. Phytochemical analysis was performed prior to the detailed in vivo studies. Animal model was used. Formaldehyde was the chemical which was used to induce the polyarthritis in the rats. 6 groups were formed. The groups were named as control group, disease control, standard control, and rest of the 3 were the treatment groups in which we use the 200, 400, and 600 mg per kg dose of the extract. Parameters which were determined or evaluated during the study and at the end of the study were clinical, biochemical, hematological, radiological, histological, and molecular parameters. The first one is the result of phytochemical analysis in which we performed HPLC and GCMS. HPLC stands for high pressure liquid chromatography. It is a quantitative analysis in which we determine the quantities of different compounds. In my plant extract, HP acid, rutin, benzoic acid, and quercetin was identified. The HP acid was found in highest concentration. The results are shown in the chromatogram of HPLC. Next are the result of GCMS. GCMS is gas chromatography, mass spectrometry. Here you can see the different peaks. 17 different peaks of the compounds were identified. The lowest peak was determined at 11.07 minutes, while the highest peak was determined or noticed at 13.701 minutes. The results of GCMS are shown in the table form. In the table, you can see the peak number, retention time in minutes, compound name, identified case number, and area percentage. Clinical outcomes of my study. The overall clinical outcomes are the physical parameters in which we determined or evaluated the results of bar diameter, body weight, and arthritic index. Arthritic index shows the severity of the disease. Here is the graph of the results of bar diameter evaluation. As you can see that the reduction in bar diameter was observed after treating the animals with the extract, plant extract. The results were dose dependent, which means that highest dose gives the best results. Next are the results of arthritic index. Arthritic index of the control group was normal. No inflammation was noticed in the control group, while the administration of standard and plant extract to the animals significantly reduced the arthritic scoring. Next are the results of effect of plant extract on body weight. As you can see that there was a significant reduction in the body weight of disease group, while the body weight was normally increasing in the treatment group. The highest increase in the body weight was noticed in the highest dose group. Next are the results of hematological and biochemical parameters. The first one is the result of HB hemoglobin level. The hemoglobin level was significantly reduced in disease group while it was improving in the treatment group. Other parameters were LFTs and RFTs, and they were improved in the treatment group as compared to the disease group. The results were mostly dose dependent. Along with the LFTs, RFTs, and blood parameters, we also determine the levels of CRP and rheumatoid factor. CRP level was significantly high in the disease group, which shows the inflammation or infection in the animals. And similarly, rheumatoid factor value was 36.70, which was highest in the as compared to the rest of the group, which means that the rheumatoid was present in the animals. Next are the results of radiological examination. Treatment group showed the reduced inflammation and preserved cartilage, while in the disease group, the inflammation was highest, along with the degradation of joints and bones. Next are the result of histopathology. The left side, which is the A side, which shows the ankle tissue exhibiting the reduced synovial hyperplasia and lower infiltration of the inflammatory cells in the treated animals. While on the right side, there is a B picture, which shows the bar tissue showing the cartilage protection in the treated animals. Next are the results of ELISA studies. ELISA studies were performed on pro-inflammatory and HSP marker. HSP70 is a heat shock protein marker, which was significantly high in the disease group. Similar to the TNF alpha and IL-6, the extract suppressed the pro-inflammatory cytokines significantly. The results are shown in the form of graphs. Next are the results of QRT-PCR studies. The gene expression was analyzed through the RT-PCR studies. Pro-inflammatory markers such as TNF alpha, COX2, IL beta, and NF kappa B were down-regulated, while the anti-inflammatory genes such as IL4 and IK beta were upregulated. The results are shown in the form of graphs. Next are the results of antioxidant enzyme acid. SOD and CAT levels were significantly increased in the treatment group, while on the other side, MDA level was reduced significantly, indicating the lower lipid peroxidation. The extract provides the protection against the oxidative stress. As you can see that the CAT level and SOD level was reduced in the disease group, while these are improved or um, uh, were improved in the treatment groups. While on the other side, the MDA level was significantly or considerably high in the disease group, and it was reduced or less in the treatment group. Conclusion of of my study: the Dermiopsis musculata methanol extract shows a strong anti-inflammatory activity, acts via the suppression of inflammatory mediators, antioxidant mechanisms, gene regulation, and supports the traditional use of the plant as anti-inflammatory and anti-polyarthritic agent. These are the references which I have used during the study. Thank you so much. Allah Hafiz.